You are live! Exclamation point! Sunday morning, coffee and conversations. Erin Mahone, if you could see me. Tara Culton, talks with tea. Welcome, ladies and gentlemen. We don't have anybody here yet, but that's okay because this is a larger conversation, and you and I are just going to have it, and they're going to join us.
That's right.
So, ladies and gentlemen, and everybody in between, all the people in all the land. You know, it's funny. I wrote a piece. I'm going to jump right in, and I'll get to Tara, but I do have to say this. I wrote a piece because we have these sort of like internalized, learned little statements and little things that we do.
Yes.
And I'm old, and so... You know,
You're old, and I'll be 60 next month, and you're old.
Well, you look younger than me, and your spirit is, I think, probably younger as well. But you know, it's just so easy to be to repeat old things, the things that we've always done, right? The ways that we always say things. And you know, back in January, I hosted the If You Could See Me show, and I said, ladies and gentlemen, and I realized in that moment that it was not an inclusive way to address my audience because there's a spectrum of gender, and I don't want to just include the ladies and the gentlemen. I want to include everyone. I want this to be an inclusive space. And so I've talked about this a few times on the podcast. I wrote about it on the blog. You know, I address these issues in, you know, anti-bias trainings, and yet I signed on here this morning in all of my glory. And I just right out of the gate, I said, ladies and gentlemen. And I just went right back to, and so but what I didn't do back in January that I want to do now is to acknowledge that I did that. That I recognize what it is, and to continue to try and make myself better. So, wow, we just jumped right into this right out of the gate.
Yes, we did.
And
I'm trying to share it out.
Yes,
right now.
Thank you. And I will do that as well. So, y'all, we are sitting here today on Saturday morning.
Oh, yeah.
What is today? May 15th.
May 15th.
Midway. It's the midpoint of our Mental Health Awareness Month. Now, as some of our guests may know, I struggle with awareness months. Not because I don't think that we should be aware, not because I don't think that we should be conscious and highlighting, especially of things that we don't often consider or think about.
Absolutely.
But I also don't want us to get complacent. I don't want us to feel like, oh, I was aware of mental health in May, therefore I'm done until next May. This needs to be a jumping off point, right? This needs to be the beginning.
That's right.
We had the same conversation in February about Black History Month.
Absolutely.
Had the same conversation in March about Women's History Month and about Traumatic Brain Injury Awareness Month. You know, like it's just so important that these months be an opportunity to expand our knowledge and to expand our conversation and to talk to amazing people like you.
Thank you.
And, you know, but like when June 1st comes, mental health is still a reality for millions of people.
It is definitely a reality. It is definitely a reality, Erin.
So, all right, it's shared. I'm done multitasking. Welcome, Tara Culton.
Thank you.
Peer recovery specialist.
Yeah, I did. I went on and became a peer recovery specialist, and I'm also now an emotional CPR. I'm certified in emotional CPR.
Amazing.
Yes. So I will be going on to become a what they call it, apprentice in it, and then a trainer. Then, so now I'm able to facilitate ECPR. And then just before I got on with you this morning, my brother-in-law says, how long will it take for you to go ahead and get that degree? Essentially. I said, you know what? My therapist told me, said it's time for you to really think about this, because this is my passion. This is making sure that we understand, and just from the everyday perspective, Erin, that we understand what's going on with mental illness, that we really have authentic conversations. And, I've said recently, I said, I think the world thinks it's having authentic conversations, and I'm not so sure we are.
Not yet.
Not yet.
We're better than we used to be.
We are so much better than we used to be.
But
so much better.
We have a long way to go.
We have a long, long way to go. And this week in the emotional CPR training, it was quite evident to all of us in that training that we've got a long, long way to go. Different people were sharing their experiences. And I thought, this is 2021. And we are still, yes, in a pandemic, but because of that, supposedly mental health has been brought to the forefront. It's we have a long way to go, but we have made strides.
Sure.
We have made strides. At least now we're not so, as a society, if you will, reticent about talking about it.
Right. And we're not completely ignoring it.
That's right.
But, like a few weeks ago, I had on one of our other family members, Amber Maiden, who is an attorney, and we were talking about sort of the therapeutic effects and impacts of cannabis.
Oh, yes.
And the impacts of the legalization of cannabis and related products and things like that. And, one of the things that we talked about, and that, I think is also relevant here, is that because those products and because mental health is something that has been so, ignored and tamped down and, put in a corner. And, we have robbed ourselves as a society of the opportunity to learn and to understand and to develop the skills to be able to talk about these things.
Absolutely. I totally agree with that. One of my nieces is in that arena now. And because of things that have happened with her, her mother died of cancer, and there was so much that possibly could have been done to help her. And we're not talking about it from the standpoint of, oh yeah, well, this is just my excuse to get high. But no, we're talking about the real valid reasons that this works for people, and it works for their mental health. Not just so they can go,
right.
But really, how
does it reduce anxiety? How does it reduce, but even, on a larger level, just sort of like the collective willingness. There's Amber's jumping in on the Facebook. Hey, Amber. Good morning.
Hey, Amber. Good morning.
Well, exactly. Amber just said both are ridiculously stigmatized, cannabis and mental health. And that is the larger piece, is that, because of the stigma, because of the fact that we have never wanted to look at cannabis, we've never wanted to look at mental health, and so many millions and millions of other, issues, that we've never learned how to talk about it. And so now that everything is being peeled back, we feel like, gosh, it's 2021.
Yeah.
Are we really still having these same issues? But we are, because we've robbed ourselves collectively of the ability to learn how to navigate these waters. It was until a few years ago, it was they have something, or they're a little off, or, oh, don't worry, they're just having an episode, they'll be okay. Or I hear all the time these stories of, my grandfather used to lock my grandmother in her bedroom for days on end, when she was having an episode.
Yeah. And that's not what we want to do. And we've come so far, and like we've acknowledged, we still have a long way to go, but the stigmatization is real. Even I was sharing a conversation with someone about having a conversation with someone about bipolar disorder. And they were like, I said, that is a whole nother, I mean, every diagnosis or series or segments of diagnoses has their stigma. But, you know, you hear people still say in the public, oh, she's just being bipolar. He's just being bipolar. There's no such thing. There's no such thing.
Bipolar is not a character trait.
It's not a character trait. It's a diagnosis. And so I'm forever saying to people, no, that they live with that experience. That's not who they are. You know, I am not my diagnosis. I am not that. That's what I live with. That's what I experience. That's what I strive to help others live through and live with or whatever. But that's not a diagnosis. And the stigma around that and speaking with this individual was like, oh my goodness. And I know it from various levels. It's like being a business owner. I went out in the waters and decided that I was going to make on-time tasks legal. So I incorporated things that I've been doing all my life. However, what I found is that on my days that I'm not at my best, it's not best for my business owners. Because when you're dealing with somebody's business here. And in addition to that, I also found that people were a little leery. I was like, well, I'm very public. I'm not hidden anywhere. Right. You know, my page is public, Talks with T, the whole thing is public. But I can understand, because if we don't know ourselves, number one, like, okay, I'm having an episode here. How am I going to handle this? And if we are not educated as a society about this, like, we don't want everybody to have to go to school to learn all the various diagnoses, the sub-diagnoses, as I call them, but educating them enough to know that, hey, there are going to be days that I may not feel my best. And me being authentic, me being whomever, I'm representing whomever, saying, okay, this is not one of my better days. That helps to ease the anxiety, because what it does, what I found, you know, this is still connected to stigma. When I don't do that, then the stigma that's already there, whether it's known or unknown to the individual, increases on days that I'm not having my best day. Because, you know, when I'm trying to overcompensate for making a mistake, like I made, this is this awesome woman who helps people's brands be more visible, right? So I just messed up, and I kept messing up. So when the day came, when there was a transition, you know, we no longer worked together, still love each other dearly. I told her I totally anticipated that. But had I not been authentic, it's possible that she could have walked away with an idea, and I could have created a stigma. If that makes sense, Amber, just chime in if you think, does that make sense? You know, it's like, so those of us with lived experience, not, how do I want to put this? Not creating a stigma or embedding a stigma in somebody. Well, you can't embed a stigma, can you? But you know what I'm saying. It's just like
perpetuating. So the idea that, you know, not only are you, you know, are you living with this, and, you know, but if you are not able to be honest about it, then it's potential that people will develop, you know, in the gap of information. Yes. People will fill it in with their own ideas.
Absolutely.
And I hear that, Tara, and I you know, I'm conflicted in my response to that. Because one, you're incredibly brave, and you are so open to being authentic and to talking about your piece, and your experience, right? Yes. And how you experience your diagnoses.
Yes.
Right? And that is so incredibly valuable. And we want to perpetuate a world in which all people have that, you know, are able to step into the light and be honest, and, you know, and at the same time, it puts a lot on a person who may not be as far down the road as you are, or as I am, or as many other people are, to say, you as a person with this lived experience have to make sure that everyone is comfortable with your mental illness.
But it's not
experience.
Yeah, but it's not, you're so right, Erin, because it's not our responsibility to make them comfortable with our story.
Right.
And I know you phrase it differently, but it's not our responsibility. It's just our responsibility to show up authentically, whatever that looks like and means for you.
Right.
It is, you are absolutely correct. And, being able to, when I went through the peer recovery specialist training, I began to really understand how vital it is to walk alongside people. Because what I tell people, I said, no, I'm not in the therapeutic arena. But what I do, I come along beside you and help you walk that journey.
Right.
Help you to possibly see that there's a pebble there without necessarily telling you that, because then you have that power dynamic going on.
Right.
That's not my place to do that. My place is just to be there to support you and whatever decisions. So we're coming from a strength-based, concept, as opposed to people are helpless. We're not helpless. Those of us with lived experience, we're not helpless. We may choose, and I don't want to even use the word need. We may choose to access the help and resources that are available, but it still needs to be our choice what it is we want to do. If we don't want to go to therapy, if we don't want to take the medications, I say to people, I said, just take the medications, but just take the medicine, but let me clarify what I mean. And they stop. I said, the medicine could be walking the dog for you. It doesn't have to be a physical pill. It could be a walk on the beach. It could
what is your medicine?
What is your medicine?
Right.
That's what I think society, that's a piece that people say, well, there's medicine for that, but are you talking about a physical medicine? Because perhaps I don't want to take that. For me, my medication journey was, oh my gosh, the side effects were too overwhelming for me. I remember years ago taking a particular drug, and my mother was like, what are you, I was here in Georgia visiting her. That's where I am now. When I get off from you, I'm gonna get ready to get on a plane, come back to Virginia. And she said, what are you taking? And so I told her the name of the drug, and she said, okay, I need you off it. I was a fully grown woman. She said, I need you off that, because all I did was wake up to take another dose of the medicine.
You were sleeping all the time.
I was sleeping all the time. And there was no, forget a half-life of the medication. It was consuming, my life.
Your whole life, right? It was your whole life.
My whole life was, get up, wash, brush teeth, all that good stuff, and then go back to sleep. So it's like, okay, what did Amber say? Oh, wow.
Amber, I love you so much.
I love you.
Amber says it's scary to say, especially in some circumstances. Yeah, I have bipolar disorder, and that is the reason for A, B, and C.
That's right.
I've had that conversation with people usually on or during a manic episode. It's uncomfortable, difficult, but being honest about my experiences ultimately makes me feel better about myself and leaves me with a healthier relationship with the individual. 100%.
Yes, and love 100%. It.
And when we treat our mental health disorders in the same way that we would treat a chronic health disorder.
Come on. Yes.
Like if you have, a chronic pain disorder, or you have, you live with cancer, or as some people do, or, diabetes, or any number of, there are things that you do to maintain your health and well-being, and you're honest about that. You talk about your, and so we want to get to the place, just like, the intro of the podcast, when it's out in the world on the podcast feed, is, mental health is health. And
that's right.
It goes so far beyond, diagnosis and treatment and meds. It's about, the whole person. And Tara, what you're talking about is a fundamental failure of our mental health treatment system that is, like, put a person on a drug and then send them out into the world, and the drug is supposed to fix everything.
And it doesn't.
And I want to make sure that, like, mental health medications, finding the right meds, changed my entire life.
See.
So like, I am not a proponent for medication.
Right.
I am not like, don't take meds. Meds are bad. I am like, you've got to be willing to, to show up to the medicine, like you said.
Come on. Mm-hmm.
And the system has to be willing to meet you as a whole human being.
Yes, because it encompasses every part of us. And when I tell people when I had my mental health crisis in 2016, the medication that I was prescribed at that time, I was like, I don't think I like the way this is making me feel. Right. And I was told by people, well, you need to wait. I was like, wait, how long? All right, I've been on this like 6 months and this is not getting better. Actually, it was getting worse for me. So I was like, and I also, because I'm not anti-medicine either. I'm like, if you need to take the pill, whatever that, just do it. However, I recognize that so many people, there's a stigma around medication.
Oh, completely.
And I remember my spiritual mom telling me years ago, she said, you just don't like to take an aspirin. Right. So for me to be able to take the psychiatric meds that are going to help me show up as I would like to show up in the world and not show up as my diagnoses, right. I want to walk in the room and people see Tara. I don't want to walk in a room and people see my diagnoses or what they suspect to be my diagnoses, right? Mm-hmm. So I had to come to the place that, okay, you need this one medication and you need the medication. For you, take the medication. Your life is much more balanced with this than not. But it's showing up for the medication, showing up for yourself, showing up to be able to understand what is going on with you individually and not from this big bowl of this is what everybody experiences, because that is so not true.
Right. Well, people are individuals. And, if we talk about, like, you said a minute ago, you're not a therapist, but I am a therapist.
Yes, you are.
So, but the same thing is true, what you said about coming alongside a person. In therapy, it's the same thing. In med management, it's the same thing. We will serve our world better. Right?
Yeah.
If we understand that this is a partnership, it is not about a power dynamic. It is not about whether a person is medication compliant. It is not about whether a client is resistant to treatment. It is about like what is being presented to that human being who is expert in themselves is not correct for them. And if it were, they wouldn't be non-compliant. They wouldn't be resistant. They would be showing up because it would resonate. It would make sense. And so it's so easy for us to like put it back on the other person and say, oh, well, they're not willing to do, or they don't want to be, or it's a false narrative that
it definitely is.
Hurts people and creates these like dueling systems.
Yes. And I've heard people in the because although all my life, really, Erin, I've been supporting people who've had mental health conditions, but I didn't recognize that was called peer support because it wasn't back then. You know what I'm saying? It just wasn't. So I remember speaking with somebody on their podcast, and she said, how long have you been doing this? Because you've been doing this a minute. I said, no. I said, I've just been talking to people and helping people. She said, honey, that's peer recovery.
That's right.
And what I've learned as I was going through the various trainings, I really began to see the disparity and, like I said, the dueling systems that we have, which then creates a divided self.
That's right.
Because now I'm trying to figure out, particularly if I've just been recently diagnosed, or even if I've had a diagnosis for years, but now I'm coming into more awareness, I'm trying to figure out, well, should I do what they tell me to do or should I not? As opposed to, like you said, my strength is I know what's best for me. I am the expert in me. Yep. So the stories I've heard, it just saddens my heart. It just really does, because as I think the beginning of the month, where every day this month I put up a post. Well, I've missed the last 4 days, and the day would be day 5. And but I take a letter of the alphabet, and I take a word, and how does that word impact those with lived experience? Mm-hmm. And in doing that, I recognized, like, one was justice. Mm-hmm. Like, is there justice for all? Mm-hmm. In the mental health, substance abuse arena? Mm-hmm. And there is not.
There is a great deal of injustice.
Yes, a great deal of injustice, because there are a lot of assumptions made, a lot of assumptions. But I started off this month with saying that let us not just be aware, let us take action.
Yes.
It's one thing, it's almost the same thing that you were saying at the beginning. It was like, it's just not mental health awareness month this month. We want to be mental health aware all throughout, exactly. Every day. And I was like, let's take action. And what will your action be this month? Right. For those who support people and they don't have a recognized, or just don't have a diagnosis or diagnoses of a mental health condition, what will your action be? How can you help stamp out stigma? How can you help those in that space? How can you help someone that you know and love, an acquaintance, a faith community member, whomever it is? I have someone in my life now, very, very precious person. They don't look like me. They're from another ethnic group. They don't live like I live. And I've said to people over and over, just because I'm a clergy woman does not mean I'm not a human. Yeah. You know what I'm saying? It's like, what will I do to help the LGBTQ communities this month, but every month?
Yes.
How can I stand up? If I say, for me, I confess to be Christian, and I say all the time, I said, I have to tell people, and it's sad that I have to do this, I'm not churchy. I'm just not churchy. If God so loved the world, and I am made in his image, and I want to emulate him, then I love the world. It doesn't mean I necessarily condone or condemn. I don't have that right.
Yeah, me too.
I don't have that right to do that. I may not understand or agree with, but that doesn't mean I don't love you. See, this is where we get off when we're talking about the mental health experience, I think, is that it's an either or. Either we're for or against something. Not necessarily. It's just that let's be open to all experiences. Let's be open to understanding that my experience as a woman of color may not look like, and frequently is not like, other people. Like I remember showing up last year. I was at my doctor's office. Oh, very good example. I was at my doctor's office and my face started drooping or whatever. And I was like, this is a migraine. My migraines will tend to show up sometimes neurologically. But my doctor, being who she is, bless her wonderful soul, she said, as a physician, I can't let you walk out. So they put me in an ambulance. I go down to this particular hospital, and people are running around, and I'm trying to say, this really is a migraine. But I understand that I don't really know that for sure, but it's acting like a migraine, whatever. They see my mental health condition diagnoses. The whole appointment shifted. The whole atmosphere shifted. And I thought, I'm trying to tell you, I'm not in a mental health episode. My head hurts, people. My head hurts. Right. So the injustice in that situation was that you totally forgot about the physical realm, the physical symptoms I'm presenting with, and you went straight to a mental health appointment that you're not even qualified. You're not even qualified to help me in this arena. So if I am having an episode, you're making it worse. And the injustice of that, or walking into a situation and realizing that people are getting uneasy, because we can feel it. We're empaths. I'm an empath. You know what I'm saying? I can feel that. I can sense it. And I tell people all the time, I can sense, just because I don't say anything doesn't mean I don't feel it. So, but that advocating for people who may not yet have the voice to advocate for themselves in those situations.
That's right.
Educating
in when you are presented with those opportunities. I think I shared this on the podcast in the last couple of months. Last year I was diagnosed with POTS, which is a neurological disorder. It affects people very, very differently. I have migraines. I get really dehydrated. I have a hard time regulating my body temperature. And sometimes I faint for, no reason. Just all of a sudden, my blood pressure drops really low and I faint. And that's been happening since I was 16.
Okay.
So when I last year was diagnosed and then also was having some vision issues, I went to a retina specialist to talk about my eye issues. And I was sitting there and I was talking to him and I said, and I also have recently been diagnosed with POTS. And he looked at my chart and he saw that I have, diagnoses of anxiety and depression and that I take medication for those things. He says, sometimes those fainting spells can be a function of your mental health and not. And I just
go off camera right now.
Right. And I just stopped and I was like, sir, I appreciate you and your medical, whatever it is, but I am very well aware of when I am having a mental health concern. I have never fainted as a function of anxiety or depression. I've never lost consciousness. I don't hyperventilate. I don't, those are not things that happen. I am, in a position and then I am unconscious on the floor. That is not, that is not a function of my mental health. But thank you for undermining everything that I am experiencing right now. Also, not what I'm here to discuss. I'm not here to talk to you about my fainting. I'm here to talk to you about my eyes. And my mental health is not affecting my ability to see.
Come on.
And he just stopped. It ended up being a very positive situation because I'm good with the words, right? I'm a good advocate. And so I took that as an opportunity to make him aware of his bias in that moment. And he was in a position to receive the information. He stopped. He was like, you're right. He turned his chair around, he sat down, he got on my level, and we had a conversation. He validated everything that I was experiencing, and it ended up being very positive.
Okay.
It sucked that I had to be in that situation.
Yes.
Right?
Yes.
But we get to, you and I and people who have done this work, we get to show up in that really hard, yucky space and feel discomfort and educate on behalf of the millions of people who aren't yet in that place.
Absolutely, Erin. Absolutely. And it's such a, I tell people just because I do this and I'm on the front lines doesn't mean it isn't hard. It doesn't mean it isn't painful. It doesn't mean it breaks my heart sometimes for myself as well as for others. It really is a matter of making that choice. And just because I do it and I have mental health conditions doesn't mean you have to do it. It just means just be safe and not safe. What's the word I'm looking for? Just be comforted in the knowledge that someone is advocating for our communities.
Right.
Someone is doing that. They're advocating for that. So I love it. I love it. What are the comments saying?
We've got so many. Danny is here. Danny and Amber are having a whole thing right now. Danny says, in my experience with mixed bipolar episodes, I find others are much more tolerant of depressive episodes. Yeah, I can totally see them. They seem more comfortable with that behavior and accepting of lowered expectations of me. That part of my diagnosis is not me any more than the other.
Yes. Great.
Amber's right there. Danny, right? As long as you sit down, shut up, and be cool, you're good. Of course, you're terribly sad, but who cares? I love Amber and your humor. She said, no, people care. I'm being facetious. She felt to correct that. This is awesome. But she says she's had a lot of those experiences as well. You're not physically sick. You're just crazy. I think that it's interesting, actually. Danny, I'd love to have you pipe back in, both Amber and Danny, because they both live with bipolar diagnoses, and hear sort of the different interactions as opposed, with depression, depressive episodes and manic episodes. Because again, it's not, there's a lot of assumptions that are made.
A lot about
all mental health conditions. And there's a lot where, you know, like you said, oh, I'm being bipolar, or they're being bipolar, or she's so bipolar. And in most cases, the person they're describing doesn't have a diagnosis of bipolar. All they're trying to say is that the person is, you know, emotional, or
that's it.
A lot.
And we're afraid of our emotions sometimes as a society.
Sometimes. We're taught how to have one emotion.
That's it.
Well, two: happiness and anger.
That's it. That's it. That's it. And there's not even a gray space to be able to experience anything else. It's like it's either or. Yep. You know, it's people talking about the bipolar space, Amber and Danny. I have had people say, well, you know, are you having an episode? No, I'm just mad about something. Like there's a bona fide reason that I'm mad. Like, right. No, there's a bona fide reason. I didn't go like screaming and hollering. I expressed my opinion. I expressed the emotion, like the I statement thing, you know, I feel when you be cut, whatever. And I'm thinking, you think I'm in an episode because I expressed myself? Mm-hmm. Are you kidding me?
Right.
But being able to say that, no, I'm not in the episode, honey. I'm just upset.
Right.
You know, there's just a huge amount of emotions that we're not, as a society, we're not taught to feel. We don't even recognize them when they show up. I remember when I first went into therapy in 2016 that I literally had to have a piece of paper because I had been trained to stuff my emotions. Mm-hmm. And it wasn't a verbal thing. It wasn't that, you know, it's just that that's who I was. And I thought I was emoting, and I was not at all. So I had to begin to say, okay, well, according to this feels like this feels like that. And to really get in touch on that deep level. But just because I'm being expressive doesn't mean I'm in a manic episode.
That's right.
And just because I'm not speaking, and because contrary to popular opinion, I really am an introvert. So, and because I show up, but you show up on stage and you do, that doesn't mean that I don't like being, I love being alone. I love people, but I love being alone. I have to recharge. But that doesn't mean I'm depressed because you haven't seen me or I haven't shown up on Facebook in a few days. I'm not depressed, people. I'm just not showing up. Right. You know, so the various nuances of that and how it plays out in society is something that I'm now beginning to say, let's take a deeper look at that. Let's take a deeper look.
You know, I think that I know that I, as a woman, was trained to explain myself. You know, my experience is, you know, it's not just no or I can't. It's a novel about why I can't and what's going on, and, you know, ensuring the emotional stability of the other person, or the, you know what I mean? And so when you layer, it wasn't even like that was a lesson. Nobody said, you know, this is what you're supposed to do. It was just how it was modeled, you know, like saying no or setting boundaries, or, you know, all of that was, you know, you just, you don't do it. And if you have to do it for whatever reason, you do it because you do it in this sort of overly exerted way, because you need to make sure that everyone understands and you feel justified in your, you know, in your setting of a boundary. And, you know, that's where it's not my job to stay quiet so you can stay comfortable comes from, right?
That's right. That's right. I love that.
We don't have to explain ourselves all the time. We don't have to ensure that everyone gets it.
That's right.
And it's okay. And that doesn't mean that we set out to create discomfort.
Right. Absolutely. Absolutely correct. Absolutely correct. Because we don't.
No. So tell me, you know, you've been on the show a bunch of times and you've been on our stage a bunch of times. Where did this come from for you? This desire to sort of buck the norms, and you're not like an overtly what's the word, rebellious person.
Right.
You're not like, I'm gonna do it because nobody else is doing. Like, where did it come from, and where did you find the courage to do it?
It came, you know what, that's a good question. Wait a minute before I answer that. Let me think about that, Erin. It just felt right.
Mm-hmm.
It felt like it was needed in the faith community. It felt as though, and then the big push came from my pastor, because she had heard all these interviews I was doing, and she had actually, it was before my first participation in the If You Could See Me project.
Mm-hmm.
And she said to me, she said, you've got to do something with this. This is something you've got to do. And I was like, yeah, okay, I'll do something next year. She said, no, this year. So within a month, Talks with T was created, and or less. And I said, because she said, make it be you, because it was myself and my girlfriend Tressie. And she said, make it be you. And that just kept resonating with me. Talks with T, like, we need to be talking about this. We need to be very vocal about this. And I recognized, because when we were meeting in person, I was, having the Talks with T in person pre-pandemic. I said, well, let me start at the beginning. I pick a topic and talk about it. And what I found that, because I didn't have a pattern for Talks with T. I said, well, let me just do it and see what organically happens.
Yes.
And it organically turned out to be sort of quasi support space for people. Sure. And my pastor said to me, and other members of the church, because it wasn't churchy. And that's the thing, like, when you came through the door, you're not pastor this, you're not Elder Tara, you're not Bishop Tutu, you're not any of those things, you
are just sitting in a circle. Right.
That's it. So people will begin to say, well, may I say something? And I was like, yeah, sure. Because, for instance, I did the series, I did a presentation on the math of mental illness. What does that mean? When we do this and this, then that equals the ending the stigma. When we speak up and we act, plus act, that equals ending. If we do this divided by this, da 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 da. Mm-hmm. And during that time, one of the members said, and I just say member because they just happen to be member of the church, but there were other people coming as well. And she said, you need to do more with this. And so I said, you know what? You need to keep talking. If nobody's there, if nobody's listening, you need to keep talking, because there's an experience, and this is like pre-pandemic. We're talking 2017, 2018. And once I recognized the gap in my community, mm-hmm. It's almost like the house thing, like what goes on here stays here. We don't talk about it and we don't recognize it. If I walk in the church and I've got a broken arm, you say, what happened to you? Or if you just say, how are you? It's like, look, oh, you broke your arm. You need to be more careful. Engaging conversation. How are you today? Well, I was just diagnosed with bipolar disorder, anxiety, depression. There's like a
right. Oh, why'd you share all that with me? I didn't ask you all that.
Keep that
to yourself.
Keep that to yourself. And no one really knows what to do with that. And I was like, just being educated on what a response could be. Everybody's response is going to be different, because we don't want a roboticized response to something. Right. You understand? But making people feel more comfortable having the discussion. I've had people show up at Talks with T said, I didn't really know why I was here. Now I understand.
Yes.
I've had people say, like, Talks with T had a birthday party. I call it's a 3-year anniversary, but it was a birthday party. And I put it off, and I really wasn't going to do it, but I really felt pressed in my spirit to do something. And so now I have people saying, when are we going to have another birthday party? And I'm saying, birthdays are once a year, but I recognize that there's a need. There's a need for a safe space. And then even to continue to talk about it for people as a clergy member, there is a space that's still not addressed. And I really was going to have an event called, wait a minute, I'm in the pandemic too. Right. For clergy. So people understand, because like I said to my pastor, I cannot even begin to understand as a leader what you have gone through, because my pastor continued to show up in our building by herself throughout the pandemic and was on Facebook Live. She's very personable, she's very loving and outgoing. But what did that mean for her? What did that mean for her when family members got sick? What did that mean for her with other people? She's in the pandemic just like we are in the pandemic. How has that affected her and her mental health? How did that affect her as she's a caregiver now? So all of these are new things that have come about, and Erin, I just want to continue. That's how it came about. And now I want to make sure to further it. I want to make sure to give people a safe space. Actually, I just created a group. There's nothing in it yet because I just did it this morning, called Safe Space with TLC. My initials happen to be TLC.
Amazing. It's just divine.
See? So I want to create that space and then be able to, for lack of better terminology, to pull them off of Facebook, because if Facebook goes down tomorrow, Facebook owns Facebook. So to pull them off of that space and really lead them through a journey that takes them from point A to point whatever that is for them. Right. Like talking about mindsets and how that affects you, not just the mental health piece, but your overall mindset.
Absolutely.
What does that mean? Even in your recovery journey, what does that look like? So I'm developing that now. And that's when I realized that, yeah, you really do love this. And I do. I love it. I love the opportunity to be able to help others, to assist others, to come along beside and collaborate with people. And they don't have to look like me. No. They don't have to look like me. They don't have to believe like me. I have a friend, the one that invited me to participate in the If You Could See Me project. And, we don't believe the same way, but I miss her so much I can't stand it. And we got an opportunity to present together this week. And we were both saying that, hey, we just need time together. And what I want to let people know is that you don't have to look like me. Ooh. You don't have to look like me. You don't have to sound like me for me to love you where you are. You don't have to be of the same sexual orientation, socioeconomic group. You don't have to be a female or male. You can be whomever you are, because my goal is that we have this bigger, huge conversation about mental health conditions and substance abuse disorders. It is not a conversation that you can package up that say, oh, this group. Yes, I'm an African-American woman, and there are some things that are different for me. But guess what? There are some prejudice, and I'm not saying that they're the same at all, or that none is worse or better, that people in the LGBTQ community experience. Are we really helping them in this space? Are we really, what are we doing to help? It's like I said to somebody, I said, I want to understand more so I don't either overstep my boundaries or break a boundary I didn't know exists, or just say something that's not true. I want
to cause as little harm as possible.
As possible. Right. Do no harm.
I was recently in a training, and we were talking about, intervening and actually de-escalation training in particular, when you're dealing with a significant crisis where someone is aggressive.
Okay. Yeah.
And the idea is that, sometimes do no harm is not possible. Right.
Right.
But harm reduction should always be our goal. These are complicated, and that's obviously, I'm not saying we should go in with the intention of causing harm, but harm reduction, we are humans. And so we are going to inherently not know things and but if I walk in with the intention to be present.
Yes.
And to engage and to be authentic, that means that sometimes I'm going to, like I started this thing today.
Yeah.
With ladies and gentlemen, sometimes I'm going to cause harm, and it's going to be unintentional. It's going to be rote. And as long as I own it and I try to reduce it as much as possible, and I am constantly learning and being a purveyor of growth and self-discovery here and everywhere, then, hopefully people will feel that desire to be good and do good and learn and grow and, and expand. And, so you're right that we have to keep pushing ourselves. We can't just show up with good intentions.
That's it. It's much
no one
more
owes us anything.
That's right. It's and to go into a situation and believe that you are holding all the answers is not the answer. That's not the answer. Like go in saying, I really don't know. I really don't, whatever it is, so that you can connect with that person or group of people on a deeper level and be able to feel what they're feeling. Mm-hmm. I may not be in their shoes, but I can feel the emotion. I can converse with them through nonverbal ways to let them know I'm present. I'm here. I'm not thinking about HGTV. I'm not thinking about walking the dog. I'm here with you now, whether with one person or a group of people. So that we don't have that divided thing going on.
But I'm also not, I'm going to take it back to what you just, and it's not but, it's and. I'm also not, to take it back to something that you said a few minutes ago, I'm not sitting there with a robotic response or trying to think about, well, this is a person who's different than I am. Let me make sure that I am, ticking all the boxes and saying everything correct, so much so that I'm not even listening to what they're saying. I'm trying to figure out what my response is going to be.
That's right.
So there's this very sort of delicate dance that we have to do to remain authentic and to remain present with one another while also developing that sense mindfulness.
Danny, I've heard that so many times.
Danny, I want to share some of this. Few people who operate within the lanes of everyday living want to look at the underlying causes of mental illness 100%. Likewise, any complex or nuanced emotion other than happy or sad is scary, and fear tells them to turn around. Mm-hmm. Someone asked me once, this is coming from Danny Holcomb, who is one of our If You Could See Me facilitators and also a family member, past participant. Someone asked me once what to do for me when I seem depressed. And I told them to talk to me, engage me, ask questions. They were unable to do that.
That's sad.
The thing. When you talk about emotional CPR, and you want to show up and you want to ask, like, well, what do we do? Mm-hmm. And it's like one of the if you're going to show up and you're going to ask somebody, what can I do for you when you're struggling, and they tell you and then you don't do it, like, don't ask the question to begin with.
Do not ask the question to begin with.
Don't ask me how you can show up for me and have me make myself vulnerable to you and share, and then not do it. It's you've got to, in that emotional CPR place, and ECPR stands for connect, empower, just for the P, but EMP, empower, and then really resonate with the person. You've got to be revitalized, excuse me. So I want to be in the space with the individual that I'm actually connecting authentically with what's going on. And in order to do that, I've got to listen. And then I've got to be able to empower them. So if I ask the question, how can I help you? My question is always, how can I support you in this space? What does that look like for you? Because it may not look like the same thing, And then I don't do it. Well, I didn't revitalize them. I've just done the opposite. Right.
I've just, taken all the air out of the
room. To become vulnerable. And then, yay, Heather. Heather. Woohoo. We ask someone to become vulnerable.
And then we drop them.
Yeah.
That's, yes.
I remember a few years ago, and I talk about my friend Susie a lot. I walked alongside her on her cancer journey. Mm-hmm. and she ultimately lost that battle.
Mm-hmm.
And it was just, it was life altering for me to be in that space. But it was, it was also fascinating to be there and watch her, because so often she said that same thing, that, people want to show up for me, or they say they want to show up for me. They ask me what they can do, and then they don't do it. And it's not about like doing physical stuff. It's
Right.
about, a lot of times I think it's easy to say, oh, well, let me know, and then not, right?
Then
Because
not.
you're in the moment, and so when you want to show up for somebody, the number one thing is like, don't make it about yourself.
Right.
Don't
It
center
cannot be.
yourself in their story. Like, if you can't take them a meal or take them to a doctor's appointment, like, you can send a text that says, hey, was just thinking about you.
Absolutely.
You're okay. You're not alone in the world. Like, you're on my mind, or my heart is,
That's right.
is here for you. Like, it does not, showing up for another person and creating emotional space for another person to not feel alone is not some sort of, like, mountain to climb. You don't
It is
have
not.
to do things. You can just be there.
Yeah, in the training this week, one of the things I was, for the second time, I was really blessed to have Dan Fisher, one of the creators of ECPR, to be one of the trainers. And I remember he calls it real play, not role play. So when my 3-day training in October, I got to real play with him. And then we have to do that to get our certification this week. We had to do that as well. And one of the things that's totally emphasized, and he does it so well because of his experience. Not his experience doing this, but his life experience.
Right.
He was diagnosed with schizophrenia and told he basically would never do anything. He walked into his therapist's office and said, no, I'm going to be a psychiatrist. I'm going to be a doctor. And that's what his therapist, kudos to him, said, and I'll be at your graduation.
That's
and
right.
He was.
Yep.
And he was. And we're taught in society in general, we do this, just, well, okay, I'm thinking about you. Da, 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 da. No. But in ECPR, you really get to sit, and there's something called the power of the pause. Sit. I don't have to say anything. I don't have to do anything. I don't have to be anything.
Right.
I'm here for you.
That's
and
right.
Even if it makes me uncomfortable, that's putting me in touch with what's going on with you. So to be able to sit in that space, and I had an opportunity to actually have to practice that full force with a situation that came up for me recently, and I was just in the space, and people were like, "What are you going to do?" I'm not going to do anything right now.
That's right.
Because I don't need to do anything, and being able to support someone in that space, and we, like Danny said, people say, what can I do for you? I've had people ask me that, and then you never say them. It's like, okay, I tell you, I remember one year I did during a suicide prevention month, I did a Talks with T virtually. And I said, okay, these are the things, if you see me doing this, da 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 da. Well, I was upbeat and whatever that day, the very next day, it was like, I couldn't get out of bed. I couldn't do anything. And so I picked up the phone. I was well aware that I needed to pick up the phone to call somebody in that moment. And I called this person who happened to be my pastor. And I was so blessed because I recognized that she was not just listening to what I was saying the day before, less than 24 hours before. She actually absorbed it. And she said, now I'm going to say to you what you told us to do. If you see something, say something. Do you think that you want to harm yourself and others? It was like immediately, well, not immediately, but if I may say that, I was like, my day is better already.
Somebody heard you, right?
It's all about being present, totally present for people in that moment, no matter how uncomfortable it makes you feel. And you're going to be, that's just the nature of being human. There will be times when you are going to be uncomfortable, but once we learn how to navigate our own emotions, we'd definitely be better at showing up for other people
No question.
and not telling them that emotional CPR is about not telling them what to do, not trying to fix it,
Yep.
you know?
Just
So
show up,
yeah,
stand there and say, you're not alone. I don't know what to do.
I don't know what to
But
do.
I won't let you do this alone.
That's right. And that's exactly, it's like, I don't know what the answer to that question is, but I'm here until we
Right.
figure it out together. You figure it out, we figure it out together, but I'm not going to figure it out for you.
That's
Because
right.
that takes your power. And we always, the goal is to come from not just an ECPR, but and what you do, what I do, Heather, Danny, Amber, we want to come from a strengths-based
That's right.
perspective, in that you know what's best for you. You know, we can't say it enough, can we?
No.
We are the experts in our own lives. We know
That's
ourselves better than anybody else.
right.
No
And
matter
when
what people may think.
no matter who we are or what role we play in another person's life, if we show up thinking that we know better because we got letters behind our names, or we,
That's
got a lot
right.
of experience, or, we're never going to be able to help a person make the kind of long-term change that sticks.
Come on, yes.
If we feel the need to tell them what we think they should be doing.
Come on.
That's not helping.
That's not helping.
That's
controlling to some degree, I think.
It's perpetuating a broken system. And so we want to create these spaces where people can feel safe to discover for themselves what is important. The thing that I do that I think is off-putting to a lot of people with the If You Could See Me project and with my Restory, work, is that when people show up to our table, whether it is a virtual table or it is an in-person table, there's no, this is how you tell your story. There is never a moment where I say, bullet point, step by step, this is how you will tell your story, because that is not my purpose. The purpose is to create the space for the story that needs to be told to be born.
Come on, yes.
But it is a terrifying endeavor to walk into a space and to have somebody, you think somebody's going to tell you how to do it. And I can't tell anybody how to tell their story. I can't tell anybody what story is meant to be told or deserves to be told. You have to allow yourself to sit in a space of discomfort and listen to the story that needs to come out.
Absolutely.
And we don't have spaces like that inherently. They don't exist.
We don't. Because there's usually a 1, 2, 3 ABC method. Like, this is the best way.
Right. If you follow these 6 steps, you will make $100,000 next year.
Oh my gosh.
I don't know if that's true. And I'm never going to tell anybody that. And so you have to have a certain amount of, faith and trust and gumption to walk into the If You Could See Me space and say, okay, well, I'm going to do this, even though what this woman that I don't know is asking me to do is absolutely terrifying. But there's never been a situation where a person has come out of it and said, this was terrible and I hate you and I hate all of this and I wish I hadn't done it.
Absolutely. It's life altering.
That's true for you.
It is. It's life altering because.
No, I don't mean for If You Could See Me. I mean, like, for your projects that I'm not, this is not an opportunity for you to tell me how great If You Could See Me is. What I'm saying is that I know you create similar spaces and that people come in and they walk out feeling seen.
Yeah. And that's what Talks with T is all about. And I, in a conversation with some wonderful women this week, I said, I just want a place where people could be. And that's how Safe Space with TLC was born. So I thought, you know what, get up, go ahead and get that group name right now in case somebody else gets it. But, and then I'll, populate it and invite people into that particular group. It is really, Talks with T. I tell people, I said, I'm T, let's continue to talk.
Let's
continue to do that. Let's continue to do that. So, with Talks with T, we're actually, what's our time?
We gotta go. We're
Yeah,
over time at
we're
this
over
point.
time.
So
Yeah.
tell me where people can find you, because we'll talk forever.
Yes, we
You got
did. Yeah.
places to go, and I got places to go, and
Yes, yes, yes. I definitely got a plane to catch today, so I can
yeah.
go back to Virginia. But people can find me on Facebook at Talks with T hyphen Tara Culton, or just if you're on Facebook, just type the @ sign. Excuse me, just type Talks with Tara C is what it is. Talks with Tara C. And then you can find me on IG, Instagram at Talks with T. You can find me on LinkedIn at Talks with T. So anything is a talk, well, not just Talks with T, because there are other Talks with T's out there, but see my face, it's going to be there some kind of way. And then we're going to have, if you go to the page, coming up next week is going to be a mindset masterclass where we're going to talk about mindset and how that affects everyday life. So they can go to bit.ly/FFP0521. And that's Foundations for Peace, because I want to show people how you have to build that foundation for peace before you can do anything else with it. You got to set some footers, you got to get your permits. And we're going to just look at this mindset thing in a different way. So we'll be doing that. Yeah.
Happy Mental Health Awareness Month, my friend.
Yes.
It's always such a joy to have you here.
Oh, it's
and
wonderful to be here.
Talk this talk with you, to talk this talk with T.
That's right. I love it.
I love you. And I wish you safe travels back home today. And I look forward to the next opportunity I have to share space with you.
Absolutely. Love you.
Love you too. Bye, y'all. Have a great week.
Bye, y'all.